Hi everyone, we're going to talk now about the mothers and sometimes the issues that mothers have following delivery. So you're home with your baby and you may have some issues that you notice is not that comfortable, and I'm going to give you maybe a few tips to help you. So pain after delivery. This is really normal that you may experience pain. You know, your uterus, it's not completely came back to its original size, so you may still have some abdominal pain. If you had a C-section, of course, it's normal that you experience pain and you don't feel like you're yourself. You say, I don't have the same energy. Completely normal. This is not time to want to be a superwoman. You have to understand that you've been through a lot. You're going to feel tired, especially if you're nursing your baby. Breastfeeding is demanding. It's really, really good for your baby and it's good for the mother, but it's also demanding. So make sure that you rest a lot. Even if you give formula, same goes for you. You need to rest. You need to look after your baby. You need to look after yourself. So be very, very okay with the fact that for the next few weeks, the next few months, you know, it's going to be maybe a different pace in your house, and give you permission to do that. Also, I want to talk again about preeclampsia, because preeclampsia is a condition that we talked about when you were pregnant. It's important to know that you can still experience that after the baby is born. And it's the same symptoms, like if you have high blood pressure, if you blurry vision, severe headache, swelling, vomiting, pain in the stomach, you absolutely need to consult immediately. The feeling of sadness and depression. It is normal for women to have the baby blues, which is due to hormones. It's very temporary. You know, you may feel like, today I'm feeling sad. It lasts for a few days and then it goes away. However, if this feeling continues, you feel like you have no interest anymore to do anything. You don't want to see people. Even you're not eating as much as, you know, your appetite is going down. Those are all signs of depression. And it's really important not to wait. You need to talk to your doctor about this. You need to talk to someone, because it's not going to go away and alone. Sometimes you need help. And it's really, really important that you share these feelings with someone. The stress, some women also feel really stressed. So for a different reason, you know, depending on our personality. But if you breastfeed, the stress of not having enough milk, this is something very common that I want to address. Nature makes it, you know, we're amazing as far as species. And when it's time to produce milk, we don't have to worry about that. So the more we feed, the more milk we're going to produce. However, the stress, like hormones, if we're very, very stressed, may have a negative impact on milk production. So then again, I recommend you talk with someone. You know, we need to be reassured as mothers that we're doing everything okay. And I think sometimes we have high expectations. So trust yourself and everything is going to be good. When to see a doctor? This is really important. So when should I go to the hospital, or what are signs that something might not be quite right? If you have a fever, you need to see a doctor. If you're nursing and you have like a lump on your breast, or you don't feel so good, of course you need to see a doctor. If you have any of the symptoms that I mentioned earlier, severe headache, blurry vision, pain in your stomach, you need to see a doctor. If you bleed in an abnormal way, of course you need to see a doctor. So for all those reasons, consult, be safe, and we'll see you in the next capsule.